Do you have surgeries coming up? No matter how old you are, we're going to talk about the help that you may need when you get home.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Hi, everybody. Thank you so much for joining us again today on Senior Care Made Simple podcast. And good morning, good afternoon, good evening, because I don't know where you all are. Hi, Lucy.
Hi, good morning, good afternoon, good evening. Here we are again.
Yay. Just bring a lot of information to all of you that out there. One of the things, Lucy, I really want to talk about it with the listeners today. And we see a lot of that sometimes for people who actually is aware of our services. Either you're young, single, older, alone, or even if you are a older person and your loved one is going to have surgery, what do you do? What kind of help that it can be provided at home? You got to remember, you stay in a hospital for 2 or 3 days. Today, most outpatient surgeries are actually done outpatient, not even in a hospital, and under general anesthesia, right? So we're going to share with you guys today some of the things that can be done to help you so you have an amazing recovery.
Yes, any procedure. And like you said, it's not just your elderly parent or as an elderly person. It can be at any age. We were talking about this before we started recording, is having procedures. So you and I both experienced having sinus procedure. And it sounds so simple, right? You think it's just your nose. It's simple. Wow. When I got up from that procedure, the pain that I felt like that pain overtook my entire body and I couldn't move. Thankfully, I was able to have my daughter there. She happened to be in town. But if she wasn't, I couldn't drive. I was on anesthesia. And when I got home, there was a whole process. I had to rinse. Did you have to do that? The rinsing?
Yeah, I had to rinse. I had to keep my head
elevated
up. And I had a cotton ball between my nose and my mouth. And for about 3 weeks, because I had a whole entire reconstruction surgery on my sinus.
So how do you get around? It's like you really feel like that, just that small part of your face, it's just controlling your whole body because you're in pain and you can't move around.
It was the worst pain I ever had in my whole life. And I don't like painkillers. That's part of our problem as well. And I did the best I can. But, I happened to have one of my caregivers actually stay with me at my house because I couldn't cook. I had to drink water with a straw. I couldn't drive. I was working with my iPad on top of my head, answering my emails.
Yeah. And you have to do that rinse. And
rinse, yes.
You have to put everything together and you really feel like you can't even move around because you're afraid that you're going to mess something up without really doing anything to mess it up. But this is just that fear that you have that anyone would have.
And, I want to also talk about, you have knee replacement, hip replacement, shoulder replacement, and this is mostly if you're a single person, a single professional that's either going for plastic surgery or you're going to any kind of surgery, make sure that you have some home health services set up for you before you come home. I had a lump in my back, and it wasn't my spine or anything. It was on the side of my back, and I came home with drains.
Oh, wow.
My surgeon never offered to have home care. Now, how am I going to drain myself if the drain is in my back?
Yeah.
Right? Well, thank God I'm in a home health industry, so I am able to actually get my nurse. So I had my nurse coming in twice a day, to drain the drain, to help me flash and everything. So, a lot of people out there don't understand and don't know that there are services out there. And what we do a lot of surgical patient in Palm Beach and Martin County. We have a plastic surgery program that actually we're going to talk about it in one of our shows coming up. But we have a caregiver that's actually go take the client into surgery, stay with them, bring them home, make sure they have their medication, make sure they have their meals, make sure they have the next doctor appointment set up already, making sure that they're comfortable at home and they have what they need. Because the first 24 hours when you have general anesthesia, it is so important that you have that support at home, because it's very dangerous for you to go home or having an outpatient surgery with general anesthesia without anybody to be with you.
Absolutely. You feel disoriented. You really need to stay hydrated, because I remember having a procedure many years ago, and the next day, my body hurt so bad. I was told that was from the effects of the anesthesia. I was in so much pain that I couldn't move. So have you mentioned having the nurse, having caregivers? The caregivers are setting everything up before you even get home.
Exactly.
It's just the smallest things, like even grocery shopping. You need nutrition.
Your medicine will be home by the time you get there.
You need your nutrition to heal. Comfort, the little comfort things you need, your blanket, your socks. How about when you get up on that bed and you're all alone, and once you got up there safely, you feel cold. Now, how are you going to get off the bed and get a blanket? Or you're thirsty. How are you going to get a drink? You want to put on socks. Having someone there, which seems so little, but it is so big at that time when you can't even move around and you're in pain. Having someone to drive you to that follow-up appointment. How do you get there? Coming home, even if they say, well, you should be fine to drive after an hour. I don't think so.
Absolutely not.
For me, I would have drove into a tree. Because the pain took over, as I said, so there's just no way you're going to get me to drive. So having someone to pick you up and take you home, go to the grocery store, get the things that you want, even if you have pets at home. I have pets. My dog will jump on me and just forget it. Everything is done. So having someone to even help you with your pets, you need someone to walk. My dog is 50 pounds. If I had a procedure, I cannot walk my dog. There's just no way. Having someone even come in, your services, they can come and they can walk the dog. They can feed the dog for you as well.
Sure.
They can help you out in the home.
It's total care.
Put a load of laundry in for you. This is great. This is just like having this perfect VIP concierge service in your home while you need it. I think it's excellent to be able to have that. As I said, I had my daughter for a couple of days and then she had to leave, and I was on my own after that. And I kind of was hoping for the best, because my fear was, even though it was just my face, my fear was I'm going to trip and I'm going to fall on my face and I'm going to totally ruin what I just, everything that was done. So it takes away the fear, and it gives you a peace of mind knowing you can rely on someone, or even call your office. Because if I was having a bad reaction to something, I don't want to immediately panic and call my doctor, but at least I know I can call my nurse at Horizon and say, should I call my doctor first? And then she could say something like, well, no, let's talk about this. What's actually, maybe I'm having anxiety, having someone talk me through it. And she would advise me, all right, let's call your doctor, or let me come out and see you. And then she could even communicate with my doctor. So it's a great resource to have.
And the other thing that I want you all to keep in mind is avoiding complication.
Yes.
So, you got to remember, you're going to surgery, no matter how little it is, no matter how big it is, you're going into surgery. There could be complications. In order for you to avoid that is, again, having one of our nurses or one of our CNAs look at the sign for infection, blood clots, the hydration, when you need to call the doctor. And a lot of people are procrastinators, like you sometimes, Lucy.
Yes.
You have a headache.
I don't listen.
Lucy have a headache for 3 days. Can you believe this? And I said to her, have you gone to the doctor? I'm going.
Waiting for it to get better.
This is the answer. But see what I'm saying to you guys?
But this is what we all do.
This is what I'm talking about. this is what we do. Humans, we're humans, right?
That's right.
This is
because
what
we're
we
used to taking care of others too. So
I know,
we
we're
think because we
caregivers.
take care of others, we can take care of ourselves.
Exactly.
And this, and as a human, as you said, this is what we all do. We wait to the worst case scenario. We shouldn't. We shouldn't waste. Planning ahead, planning to have someone that's going to take you to your procedure, pick you up, get your medications, get your food. Let's be proactive. I mean, we do this when we're traveling, right?
Absolutely.
We pack our, I mean, you just came back from traveling. How far in advance do you pack your bags before you leave?
Actually, believe it or not, at the last minute.
At the last minute, see, procrastination.
You know why I do it the last minute? Because I know that I'm not forgetting anything.
Okay.
It's just me, though. That's
Okay.
just who I am.
But if we planned ahead for a procedure like we did traveling, so let's
That's
say
different.
packing. So, okay, for instance, baby bags before a baby is born. How many moms, and I did this for the first, after the first, you kind of just like wing it, just take a diaper with you. Before you have this baby, you pack this baby bag, right?
Right.
And you pack their first outfit they're gonna wear, which realistically don't even wear that outfit. But anyway, you pack this baby bag because this is a new life you're bringing into the world. And this is what we do as mothers, especially first time. We have the bag packed, we're ready to go. We have this baby bag packed a month in advance. Why are we
That's
not preparing
true.
for ourselves
Agree.
before
That's
a
true.
procedure? That if I'm going to have a procedure next month, I really should be prepared in advance. And you talk about procrastination. I admit to it. I take accountability because I had a total hysterectomy years ago. And I didn't plan too well in advance because I honestly felt like I can handle anything because I was still in my 40s. And I went home and I had someone helping me, but I still felt that I had to be in control to the point, in fact, that I wanted to start working out. Now, my doctor told me, wait 2 or 3 weeks before you start working out. So I started early on because I felt mentally strong, and that wasn't a good thing. So I waited to see the doctor. I didn't tell the doctor in advance I was having some kind of discomfort because the fear that I didn't want the doctor to get upset with me. But I didn't have someone overseeing my care. There wasn't someone in my home that can say, you know, you really shouldn't be working out yet, or you really don't look too good today. So what happened was when I did go back to my surgeon, I had to have another procedure
Oh, my God.
because I didn't listen and I didn't have anyone at the house with me that was really helping me. So I wanted to do things on my own. So I was walking and I was doing all these things that I should have really waited. And we do that. We feel we can do it all on our own. And it was a lesson learned for me. Never again. I will absolutely now plan in advance, have someone else and put the ball in their court. Allow the professionals to do their job. I know better now. I have no excuse, especially working in home health. Have someone there because in that way I have peace of mind, but I'm going to heal properly. And it would have avoided me going back to the doctor. And I would tell you off the show what had to be done after. And it was not fun because I didn't listen. But it's a lesson learned and avoid learning that lesson. Prepare in advance, really.
You know what I learned from my Brazilian Italian grandmom? Do it right at the first time.
That's right.
It is always better. Now, I pack at the last minute, don't get me wrong. But when I have a procedure, let me tell you something. I plan in advance, 2 months, including make sure I have my healthcare surrogate papers,
That's
my
so
DNR,
important. That's right.
everything
That's right.
prepared. Now, I am good at that because I've been in this business for 40 years of my life. I have dedicated 40 years of my life to take care of other
That's
people.
so right. That's so
I'm
great.
very
you brought that up.
organized when it comes to that. By the time I have surgery, my bills are paid ahead. I have everything
Have a
in order.
checklist.
I have a checklist.
checklist.
I do pack at the last minute,
Yeah.
that's for sure, anyway.
But I think that's great that you mentioned having all these documents in order. That's awesome. Because you forget about that. You forget that you don't want the worst to happen, but the worst could be happen. And you want to be prepared for when you come out of that procedure that you're being taken care of. So that's
even if
absolutely
it's
right.
like, you know what I recommend too? Even if it's 3 days, 4 days, I mean, just please have somebody with you. It is so important. And if you do get to stay in a hospital, have a caregiver stay with you in a hospital. Hospitals are shorthanded now.
Yes,
People
they
are
are.
running crazy. People are not going to nursing school. Physicians are not going to medical school as much as they were in the past. And, our healthcare system is changing so much. I'm just here to protect you guys, to warn you guys, and for you all to just think ahead, because thinking ahead and making a good plan always going to have an amazing outcome. And Lucy, you and I were talking about it the other day. When you are not in this business, when you're not in healthcare,
You don't know.
right? You don't know there's just kind of services out there, right?
That's right. You don't know.
And even sometimes, like the other day, yesterday, I was talking to OBGYN oncology doctor, talking about our oncology program. And he's like, oh, you guys are Medicare. No, we are hourly living care. This is what we do, from food shopping, medication management.
Even skilled care.
And he looked at me like I had 5 heads. And, so he's a physician himself. He's an oncologist. So a lot of people don't know our business. The first thing they think about is Medicare home care, which is intermittent. And we talk about that in the past and some of our other episodes. Or, they don't understand that there can be someone with them 24 hours a day for as long as
that's right. Because not everybody has family or local family. So what happens to them? They need someone.
And even if you do have local families,
they're busy. They're working.
Right. They have their children. They have their family to take care of it. They have their jobs.
That's right.
Some people still work 60 hours a day.
We have
right?
bills to pay.
And yeah, of course.
We have bills to pay.
So it's so important that just plan ahead. Surgery is something that is very, very dangerous to have, period, no matter how small, how big it is. Make sure that you have someone for your peace of mind, and your doctor will have better outcome and he will applaud you. I promise you.
Yes,
because
right.
It's right.
No,
because
absolutely.
the doctor will have better outcome.
My doctor wasn't happy with me. So you want your doctor happy with you, because they feel that they want to do the best job they can, but you have to do your part as well. And doing your part is preparing, listening to the doctor, listening to the orders that they give you, and having someone that's going to hold you accountable for everything at home.
Well, thanks everybody for joining us again. And if any of you have any questions, wants us to talk about anything that you have in mind, would like to come and talk in our podcast about anything, please email us at seniorcaremadesimple@gmail.com. seniorcaremadesimple@gmail.com. Thank you, Lucy, again.
Thank you. Had a great time as always. Can't wait till next time.
We have a wonderful time. You stick around for more of our podcast coming next week.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.